So let's talk about health equity. From my perspective, I have to say, this is long overdue. We haven't been addressing key segments, and through the different programs that the government's, incentivizing now, we're finally seeing some traction here.
So I really liked how the government took ACO REACH and forced it. It's a really solid first attempt at making health equity a key component of a program. We've got to create health equity plans, and it's really imperative that health equity plan actually include quantifiable, measurable objectives. I just really appreciated the fact that the government really thought this one through. And a lot of times they don't. They actually said, look, go out, figure out who your populations are, figure out how you're going to serve them, be really explicit, stay really focused, tell us how you're going to measure that. And then we're also going to look at your population, and we're going to incent you if you have a particularly disadvantaged population. And that was something different, right?
Right, and the data's out there, and it wasn't rocket science to figure out who were your most vulnerable patients in your population, and creating actionable lists for these health equity plans to be implemented.
I think one of my favorite things was looking at a specific region of the country, understanding that region of the country, really digging into what's going on there, and then helping somebody say, hey, how are we going to help that? And you could actually envision how these really disadvantaged folks were going to be touched by something that started at the highest policy level, and to actually get in there and see it happening at the beneficiary level. Like we very rarely do I feel like we get to do that. And I was really impressed. I think they did a good job.
CMS used to be behind the curve on a lot of these items. They're leading now. They're not behind.
I think ACO REACH was something where the government is starting to really give folks a way to take on risk. When you look at those that are in it for the right reasons, this is really a path, right? It's really exciting. I hope we continue to see them do this.
Yeah, it's exactly the kind of work we love doing. You can actually feel like you're making a difference in these vulnerable populations that have been ignored.
It's not just another thing that we have to do. It's not another box to check.
Right.
It's actual thing that you can see come to fruition and be effective.